Hi folks, today's topic is what? Ankylosing spondylitis. Okay, commanders, take your pens and papers and let's go. So what is ankylosing spondylitis? Let's go. Let's dive into ankylosing spondylitis. So you start from definition, remember always. So ankylosing spondylitis is a prototypical spondyloarthropathy, my beloveds, and a systemic disorder characterized by inflammation of the axial skeleton, large peripheral joints, nocturnal back pain, back stiffness, accentuated kyphosis, constitutional symptoms, aortitis, cardiac conduction abnormalities, and anterior uveitis, inflammation of the eyes. Diagnosis requires showing sacroiliitis on imaging, and management is with non-steroidal anti-inflammatory drugs and NUS, tumor necrosis factor antagonists on interleukin antagonists, of course, as well as also physical measures that maintain joint flexibility. So definition like this is quite sufficient. And then you go into detail. So ankylosing spondylitis, once again, it's a chronic inflammatory disease, autoimmune disease that primarily affects the spine and sacroiliac joints, leading to pain and stiffness. Over time, this spondylitis, ankylosing spondylitis, can cause some of the vertebrae in the spine to fuse, resulting in a loss of flexibility and hunched forward posture, kyphosis. So if you find, for example, etiology, so you start with definition, blah blah blah, that I have mentioned above. Then we have to say that exact cause of ankylosing spondylitis, exact cause is unknown, but it's believed to involve a combination of genetic and environmental factors. The most significant genetic markers associated with this condition is HLA-B27, which is present in more than 90% of patients with ankylosing spondylitis. However, not everyone with this gene, HLA-B27, will develop the disease, suggesting that other genetic or environmental factors play a role. And concerning pathogenesis, so etiology pathogenesis, the pathogenesis of spondylitis, ankylosing spondylitis, involves both the immune system and the skeletal system. The presence of HLA-B27 gene is thought to trigger an inappropriate immune response. Actually, it's not a trigger, it's a predominance, if you want, predisposition to immune response, leading to inflammation in the joints and anthesis. Anthesis is the sites where tendons and ligaments attach to the bone. So, my beloveds, this chronic inflammation causes the characteristic symptoms and progressive changes seen in ankylosing spondylitis. So, pathophysiology. In pathophysiology of ankylosing spondylitis, we talk about inflammation. So, the initial phase involves inflammation of the sacroiliac joints and the anthesis. The inflammation is driven by immune cells and cytokines. Cytokines, bone erosion. So inflammation, bone erosion. Chronic inflammation leads to the erosion of bone at the affected sites. New bone formation in response to the inflammation and bone erosion. The body attempts to repair the damage by forming new bone. However, this bone formation is absolutely abnormal and leads to fusion of the joints, ankylosis. Okay? So in response to this inflammation and bone erosion, the body attempts to repair the damage by forming new bone. However, this new bone is abnormal and leads to fusion of the joints, ankylosis. Fusion is ankylosis. Joint fusion, over time, the new bone bridges the joints, leading to reduced flexibility and eventually complete fusion of the spine, bamboo spine. Symptoms. Back pain and stiffness. Of course, symptoms. But you start always with definition. So back pain and stiffness, typically worse in the morning or after periods of inactivity, and improves with time with exercise. It's very interesting. Reduced flexibility, especially in the lower back and hips, in the problematic zone. Postural changes. As the disease progresses, it can lead to stopped posture. Pain and swelling in other joints such as the hips, shoulders, knees, and the feet. We have the problem. Fatigue due to chronic inflammation and pain. Enthesitis, inflammation of a tendon or ligament insertion sites leading to localized pain. Uveitis, inflammation of the eye causing redness, pain, and blurred vision. Uveitis. Diagnosis, after talking about definition, after finishing, if there is a question, for example, I see diagnosis, clinical examination for assessment of symptoms, medical history, and physical examination. It's okay for all pathological conditions. Imaging techniques, X-ray and MRI to detect changes in the sacroiliac joints and spine. X-rays or MRI to detect these changes in the sacroiliac joints and spine. X-rays, so imaging, may show changes like sacroiliitis or bamboo spine in advanced stages. MRI more sensitive in detecting early inflammatory changes. Yes. Laboratory tests, so HLA-B27 testing. While not definitive, the presence of HLA-B27 can support the diagnosis. Inflammatory markers. Inflammatory markers, ECR, elevated sedimentation rate, and CRP, so C-reactive protein, can indicate inflammation. Treatment. So what do we've got? Medications. NSAIDs, first-line treatment to reduce pain and inflammation. DMARDs, disease-modifying anti-rheumatic drugs such as sulfasalazine for peripheral joint involvement. Biologic agents, TNF inhibitors. What do we have? Like the biologic agents. Etanercept, actually no idea. Etanercept, adalimumab. Etanercept, adalimumab. And interleukin-17 inhibitors, secukinumab. It doesn't matter how you pronounce secukinumab. You have to remember. I will not remember definitely. So biologic agents, TNF inhibitors and interleukin inhibitors for patients with inadequate response to NSAIDs. Anyway, so analgesics or painkillers for pain management, physical therapy, crucial for maintaining flexibility and postures, exercise focus on improving range of motion and strength, lifestyle modifications, actually the same, regular exercise, good posture practices, and avoiding smoking. Surgery rarely required, but may be necessary for severe cases with significant joint damage or spinal deformities. So briefly, it's largely sufficient. So ankylosing spondylitis is a lifelong condition that requires comprehensive management to control symptoms and prevent complications, and they are. So early diagnosis and the combination of medication, physical therapy, lifestyle changes can significantly improve the quality of life for individuals with ankylosing spondylitis. And the regular monitoring and a multidisciplinary approach are absolutely essential for optimal care of this ankylosing spondylitis. So, my beloveds, largely sufficient, absolutely, for ankylosing spondylitis. See you in another lectures, my beloveds. God bless you.